New at 6 tonight, a national chemo drug shortage. It's preventing some cancer patients from getting the treatment they need, and some infusion centers are reducing or not offering at all one of the drugs used in treatment.
And Tampa Bay's Malik Rankin shares how our local cancer treatment centers are adjusting.
It's like my actual life that's at stake, and so finding out that we're in a shortage is, it's rough.
Madison Beloy is fighting stage 4 colon cancer. She tells me she's already been impacted by the chemo drug shortage during her last few treatments.
2 times in a row, I only received half of the chemo cocktail that I was supposed to receive. Even if they had Carboplatin in stock, they wouldn't have given me the full amount because of the shortage.
Beloy receives cancer treatment at Florida Cancer Specialists. Cancer drugs impacted by the national shortage are Cisplatin and Carboplatin. At Moffitt Cancer Center, they have a 2-month supply of one of the more commonly used chemo drugs. They tell me that's typical, but what's concerning right now is how long they'll be able to maintain that 2-month supply in the months to come. Ken Camorney is the VP Chief Pharmacy Officer at Moffitt. He tells me a recent FDA approval has alleviated concerns surrounding the shortage of Cisplatin.
Carboplatin, on the other hand, is a drug that is a little more limited in supply. Our stocks are a little less. We've had to put restrictions in place for that drug.
Camorney says this means switching some Moffitt patients to alternative medicines for treatment.
We also look at things like dose reductions and duration limitations, and if, based on the clinical literature, if that can safely be done.
Moffitt Cancer Center says they're prioritizing Carboplatin treatments for patients who can't have substitutions. For those on the receiving end of a modified treatment plan, it's tough.
To be given another thing that I don't have any control over, it makes me feel very vulnerable.
In Tampa, Malik Rankin, 10 Tampa Bay.
Moffitt Cancer Centers tells us they met with officials from the FDA last week. They were told more Carboplatin would be made available next month, hopefully alleviating the current shortage.